Today, let's see what your tongue is trying to reveal about your health. You should check your tongue because it might be trying to tell you something important. So, this is how a normal tongue looks like, pink and moist. Most healthy tongues are pink and moist. When there is a mild coating which is temporary, that's normal. But what matters is a new change or a persistent change. That's when it needs assessment. This is a white coated tongue. A white coated tongue can have various reasons, right? From common reasons like food that has settled over the tongue, or because of having a dry mouth, or some people are mouth breathers. They habitually breathe through their mouth that leads to dryness of the dryness over the tongue, and that leads to white coating. And sometimes some white plaques can be due to oral candidiasis, which is a fungal infection. So a temporary white coated tongue may not be important, but a persistent white patch which does not resolve definitely needs attention. This is a red smooth tongue, so which can be due to various reasons like iron deficiency or vitamin B12 deficiency or vitamin B9 or folate deficiency. Can also be because of some irritants or inflammation of the tongue or some medications. This is a pale tongue which makes us suspect anemia, although it's just a clue and not a diagnosis of anemia. This is a cracked or fissured tongue. It is usually harmless. It's considered benign. What matters here is good oral hygiene because sometimes the food may get trapped and get deposited in the fissures. But if there's any pain, swelling, or ulcers, or any new persistent change, that deserves attention. This is a swollen tongue. A swollen tongue deserves attention because the causes may range from minor causes like some injury or inflammation or can be serious allergic reaction, which may lead to breathing difficulty when it becomes an emergency. So persistent enlargement needs clinical assessment. This is a dark or purple or a blue tongue, which can have multiple causes from pigmentation to medications to smoking, and some infections or systemic infections can cause this, and sometimes it can be an unexplained discoloration, and it can also be indicative of a heart or lung disease. So it's just a clue, it does not diagnose the disease, but it definitely needs assessment. So when should you see a doctor? When you find a sore or an ulcer over your tongue which persists beyond 2 to 3 weeks, or if there's a fixed white or red patch which does not resolve. An unexplained bleeding or a lump definitely needs assessment, and progressive swallowing or speech difficulty. And if you find a swollen tongue with breathing difficulty, it's an emergency. So if it is persistent or a new change, it should be assessed by a dentist or a doctor, and do not ignore a tongue change simply because it looks small. So there are some myths that a white tongue always means a fungal infection, but it's not like that because white tongue can have many causes. It's the persistence and it's the persistence basically that matters. Because the white tongue can be due to, as I said, various other reasons like a dry mouth or mouth breathing. Purple tongue proves poor circulation. That's a common myth, but color changes are non-specific and they need clinical context. The tongue in isolation does not diagnose it. So your tongue can offer clues. So that's why you should check your tongue. And if you find a persistent abnormal change, always consult a doctor.